Dumelang Mzansi, welcome to the Health Club. My name is Clement Manyatela and I'm your host. This is where we create space for you to take charge of your wellness, one informed choice at a time. Proudly brought to you by GEMS. Today's conversation is all about staying ahead of illness, not just reacting to it. They say prevention is better than cure, and in healthcare, that couldn't be truer. From diabetes to high blood pressure, early detection can save lives, and it starts with you. Today, we're diving into the power of preventative healthcare, annual screenings, healthy lifestyle choices, and how the workplace is becoming the new frontline in the fight against chronic disease. Because your health shouldn't be left to chance. It should be your plan. Here's what you can look forward to in today's episode.
The country is struggling with issues of what we call non-communicable diseases.
Stress and burnout is a major problem at the moment. Estimates is it's costing the country around 200 billion rand per annum.
Not all employees are aware of their health issues before being screened.
Thanks for staying with us. As we've seen, the conversation about preventative healthcare isn't just medical. It's personal and it's social, and it affects how we live and work. To show us how the workplace is stepping up, we spoke to Chris Late from the Workplace Wellness Association. He's been at the center of helping companies bring health screenings directly to their employees. Take a look.
My name is Chris Late. I'm the CEO of the Workplace Wellness Association of Southern Africa. I'm here today to talk about corporate wellness, workplace wellness, and what organizations can do to enhance the wellness of their employees. Screenings in the workplace is very important, mainly to detect potential illness in an individual early. Also gives a specific focus in terms of screening, not only from a detection point of view, but specifically also from a preventative care point of view. We don't do the screenings ourselves. We as an association is there to assist employers and service providers through the process. The typical screenings at the moment is around disease management, so detecting things like TB, HIV/AIDS, but then also a strong focus over the last 10 years around non-communicable diseases, hypertension, diabetes, those kind of things. Post-COVID, a significant shift has gone into psychological evaluation. We see stress and burnout is a major problem at the moment. Estimates is it's costing the country around 200 billion rand per annum in lost productivity due to mental illness. The reality is that, and this is our president recently quoting, that South Africa is losing between 12 and 16 billion rand per annum due to absenteeism. Now that is significant, but absenteeism is just the point of the iceberg. It's fatigue. It's not being able to cope in the workplace. Unfortunately, as we become older, the cost of healthcare becomes more prevalent. There's a lot we can do. And again, I really want to take the opportunity to encourage employers to look into this and to understand the long-term return on investment.
Welcome back to the Health Club. Before the break, we had Chris Late giving us a powerful look at how the workplace is evolving into a front line of healthcare, turning boardrooms into wellness rooms and screenings into routine. But the message is clear. Prevention is no longer a luxury. It's a necessity To dig deeper into why proactive health screenings matter and how they're being implemented across the country, I'm joined now by Dr. Fundile Nyati, who is the CEO of Proactive Health Solutions and a leading voice in workplace wellness and preventative care. Dr. Nyati, welcome to the Health Club.
Thank you very much. Good afternoon to you.
So Chris there was talking about the shift in workplace culture and around health as well. But from your own experience, how have South African workplaces responded to this call for preventative health care?
Pre-COVID, most of the companies or most of the workplaces, they were not walking the talk. On those big days like World AIDS Day and other big days, CEOs would stand up and make pronouncements and tell the people that our employees are the most important assets. But if you then looked, are you resourcing programs to take care of their health? The answer was that they were paying lip service. Post-COVID, that has changed. Quite a number of employers now, they are actually taking matters of the health of their employees very seriously because they learned during the time of COVID that matters of health are not just, tissues and tears kind of issues. They actually can affect the bottom line.
Yeah, it's good to see that there's improvement. So from the screenings that are being done, in your observations, what kind of conditions are being picked up and what does that tell us about the state of our health?
What we have been seeing even before COVID is that the country is struggling with issues of what we call non-communicable diseases.
Yeah.
That is what other people will call them lifestyle kind of diseases. Diseases that are not because of a germ moving from one person to the other. That is non-communicable diseases. Things like high blood pressure, things like diabetes mellitus, things like high cholesterol in the blood, things like obesity, the cancers, all of those, there's no germ that is involved. It's a lifestyle issue to the extent that Stats SA, I think about a year or two ago, they did actually report that just over 50%, about 54% of deaths in South Africa are related to the complications of these. A change from maybe a decade before, where the leading causes for deaths in South Africa were as a result of infectious diseases like HIV, AIDS, TB, and all of that. The other issue that we are seeing in workplaces is the rise of mental health challenges, especially after COVID, because there's a lot of trauma that people went through during that period, of COVID. Other people are still battling with, the losses of friends, the losses of their family members. They were not able to go and have proper closure because the funerals were different. And also others who did get COVID, they are now complicating with mental health challenges. There's an article that came out on the Lancet Psychiatry in 2021 already, which showed that at least a third of those people who did get COVID, within 6 months, they will present with some neuropsychiatric problems, so mental health problem, which is now becoming more of long COVID. So what we are seeing, therefore, it's a steady rise in these diseases that are lifestyle related and diseases of mental health, which again, they are not infection related.
So here's the challenge then, Dr. Nyati, because even when workplaces are getting these screenings done, there are some people in the workplace who are scared. They try and avoid the screenings, either because they are scared of any diagnosis that can be picked up or they just don't like the process. So how do we make preventative healthcare less intimidating and we can get people to start wanting to do this?
So companies have been doing these screenings to try and pick up these non-communicable diseases. But what we are finding is that when you look at the two genders, males and females, most times when you have these wellness screening days, the females will be the ones who are in the majority, maybe 2/3. Males are generally not good at going for screenings. It's part of that macho thing of ours, whereby, you know, the only time you'll go and seek help is when things are really, really bad.
Yeah.
But then people belong to medical aids like GEMS in the public sector, and there are benefits whereby you can go to any doctor or even lab and get screened for some of these illnesses. And in so doing, you get points, you know, and all of that.
So they incentivize you to come out.
There are incentives for you to actually go and screen, because the thinking is early detection saves lives. You know, that's the theme. So when you then say, fine, I may not have been able to prevent, but can I at least know if I've got a problem so that it can be dealt with before it complicates? For example, you are a long distance runner. You know, you are dealing with one of the risk factors, which is, you know, low physical activity or physical inactivity. By doing what you're doing, running different countries, you are dealing with one of the big, you know, risk factors, which is inactivity. But also, because you have a very hectic lifestyle in the work that you do, by running, you are releasing happy hormones that help you to reduce your stress, whilst reducing your risk of diabetes, which comes with obesity, reducing the risk of high blood pressure, you know, which also can be as a result of the inactivity. So we need to educate people to know that as much as these lifestyle illnesses are a big driver of deaths in South Africa when they complicate, but there is something that you can do.
Yeah, well, how do we rope in other stakeholders here? Because, and by the way, after how you've explained the benefits of running, I don't think I'll be slowing down anytime soon. So how do we rope in the other role players, like unions, for instance? I mean, are they talking, you spoke about wellness, are they talking to their members about this? Government as well, so that you don't leave this to just workplaces, but all stakeholders especially speak to the men and in the entire society to realize the importance of preventative healthcare.
We need massive campaigns to create awareness. We need to create opportunities whereby you can go to a nearby clinic and be able to be screened. If you have a medical aid, you know that if you go and do those screenings, you're going to get points if you are from one of the big medical schemes that actually incentivize to do that. But it must be something that we take responsibility that once a year, I must know my numbers. You know, once a year, I must know how's my blood pressure number, how's my cholesterol number, how's my diabetes number, you know, you also mental health wise, you know, what incidents have I suffered in the last 12 months that may increase the risk of mental health. You know, so we live in a country that is very, very, you know, stressful. You know, there's violence and there's many things that trigger us. So both mental and physical health side, we must make it our business as individuals and encourage those around us.
So we've heard how workplaces are stepping up, but what about the outreach happening beyond the office in our communities? We caught up with wellness specialist Nozuko Mutsuyane to see how proactive care is being taken directly to the people. Take a look.
Good day, my name is Nozuko Mutsuyane, and I'm going to be talking to you today about corporate or employee wellness. And I come from the organization called the Workplace Wellness Association of Southern Africa, and I'm a board member there. Not all employees are aware of their health issues before being screened. Screening is important because it helps employees to know exactly what the risk is, and sometimes this risk can be mitigated, which would help an employee to change a lifestyle, change eating habits if that is what is needed, and live a life of prevention instead of cure. Screenings help combat a cost to the employer, by making sure that people know what their health risks are and dealing with those health risks by finding ways or means of mitigating that risk. If it doesn't happen that way, employers will obviously deal with people not coming to work because they are now ill. But if it was checked beforehand or prior, it would have been easy for the employee to know what it is that they need to do, change their lifestyle, change their eating habit, reduce drinking habits, reduce smoking or cut it out completely, etc. Absenteeism can be reduced because when employees know what is wrong with them, they know what to do. So for an example, if there's a gym in the organization and we find that most people have a BMI issue, if they are screened and their BMI is known to them, then they can start registering or enrolling with the gym, and most probably organization would introduce something like healthy eating lifestyle through their canteens, and these employees would then be at work because there's facilities for them to reduce their weight, and also there's good eating habits in the workplace, and it's just a general feeling that the employer cares about me, the employer knows me personally, they know what my personal circumstances are. More people would want to come to work. When team members see as they model behaviors of leaders, when they see you living a healthy lifestyle, when they see you posting that you ran the comrades, then you tend to lead an organization that is more aware, more conscious, and wants to be like you.
Welcome back. That was Nozuko Mutsuani showing us just how powerful health education and screenings can be when they meet people where they are, in the malls, the clinics, and even at churches. We still have Dr. Nyati with us here in studio. And Dr. Nyati, seeing just the kind of community outreach that's out there, how important is it then to build long-term health habits in South Africa?
It's extremely, extremely important. It's very, very important, like I said, but not in a paternalistic way where somebody must tell you what to do. We must make it our business as individuals. Changing what you eat, to have less salt. There's people, when they get a plate of food, before they even taste, they're already putting salt, Yet the recommendation is, let's have less salt in our food. So taste the food first before you add salt. The issue of eating foods that are high in bad cholesterol, the fast food that you get from the different places there where they drive through, those things have got a lot of bad cholesterol, which will clog your arteries. So the things are simple things to do, but you must do them because you've bought into the idea that if I modify these risk factors, I will keep most of these lifestyle diseases at bay. We haven't talked about the cancers. They are also non-communicable. Most of these cancers, for males, prostate, right? You just do one little prick test called PSA. It will tell you if you've got a problem or not. If we look at females, you go for a pap smear, or you go for a mammogram, or even examine yourself if you don't have the money to go and do that. Something called self-breast examination if you're a woman, or clinical breast examination if you go to a clinic. It does not cost much. So these things that need to be done are not costly, but it's things that are accessible to most of us. But obviously, if you don't have a medical aid, you can still go to a clinic and just have once a year. You just do that. You will have been able to understand your risk and deal with it, in a way that will help you to deal with the long-term challenges, should you have one of those.
Dr. Nyati, thank you so much for these powerful insights.
Yeah, thank you very much, and thank you.
Before we wrap things up, we've still got one more story to share, so please stick around. We'll be back right after this. Welcome back. So far today, we've explored the importance of preventative health care, from boardrooms to communities. And one thing is clear: early action saves lives. It saves time and it saves money. And it's not just the medical professional saying it. medical schemes like GEMS recognize that prevention is just as important as treatment. That's why they continue to invest in wellness programs that support proactive healthcare for their members. Now, take a look at how GEMS is putting prevention at the center of its approach.
I'm the GEMS Chief Operations Officer. When we talk about preventative healthcare, we're talking about early detection and early intervention in terms of illnesses before they complicate or become serious. So why it's important for us to have preventative care is that firstly, we want to empower our members to understand their health needs better, but we also want to make sure that we screen and detect these diseases early so that we can intervene early. Our preventative benefits are available across all options. And the reason we want to do that, I think, is also because we want to make sure that there's access for everyone. In addition to that, our preventative and screening benefits are funded from what we call the risk benefit. And really what this means is that members don't have to worry that their day-to-day benefits or their acute benefits will be depleted because they go for these tests. So one of the problems we have with the healthcare industry, and especially the private healthcare industry, is that we've moved away from primary healthcare and prevention to a very hospice-centric way of doing things. So GEMS really promotes primary healthcare and prevention because that's where it needs to start. We need to start at primary healthcare level, make sure that people get the right services at the right level, make sure that people understand their healthcare needs and where they need to go for screening tests, go for regular checkups with your doctor. So we definitely promote primary healthcare, prevention, screening. And this will also help us to move away from this hospice-centric based care, which means we don't want people to end up in hospital or focus on hospital. We want to go back to the basics and focus on primary healthcare and prevention. So one of the really exciting things over the last few years is that we've been engaging with a lot of partners that are providing mobile services. So, previously you could only go for a pap smear at a GP's office, for example. Now there are entities that provide mobile services, and those mobile services can actually come with us to the wellness days.
Now that's how it's done, prevention with purpose. GEMS continues to lead the charge by making sure that their members don't just get treatment when they're sick, but they also get support to stay healthy in the first place. Because being informed is the first step in taking control of your health. Here's what else is making news in the world of healthcare and wellness.
Welcome to GEMS News. In this edition, we highlight the importance of preventative healthcare and regular health screenings. Preventative care means proactively managing your health through regular checkups and screenings, even when you feel healthy. Screenings for conditions such as diabetes, high cholesterol, hypertension, and cancer can detect health issues early when they're most manageable. GEMS covers a range of preventative screenings through your benefit options to help you stay healthy and avoid serious and costly interventions down the line. Make preventative care part of your regular healthcare routine to protect your well-being and ensure a healthier future. For more information, visit the GEMS website or contact us through our social media channels.
What a powerful reminder that our health is in our hands and that taking small steps early can make a difference later. From community screenings to workplace wellness and digital care, it's inspiring to see how GEMS and others are showing up for South Africans. Remember, prevention isn't a luxury, it's a lifestyle. So take the time, book that checkup, ask the questions, and look after yourself and your loved ones. From all of us here at the Health Club, thanks for watching. We'll see you next time. Please stay informed and stay proactive. Lisaleng Hantle.